So I think what I really admire so much about TRU is the focus on the social aspects of mental health. You know, it's the biopsychosocial model of mental health and mental illness, where yes, we accept that these are illnesses that have some sort of a biological basis and can be improved by medication, and that's the role of the doctor or the psychiatrist. But there's so much more that actually goes into the quality of life that really needs concerted efforts to kind of address, and those are, those require so much more of a focus from the social aspects. And the project over here being structured more from the ground up rather than the top down, where we do have psychiatrists, but the work is predominantly based on what the social workers do. And then that ties in and feeds what the psychiatrist and what I, as the junior doctor assisting the psychiatrist, also help with. So in that sense, I think that's really interesting to me. I think that this is a project style that I have not seen anywhere else. I'm sure that there may be other projects, but I have personally not seen.
કોઈ પણ તકલીફ હોય એ માત્ર 10-20 કે 30 રૂપિયા પૈસાનો સવાલ નથી, પણ ત્યાં આગળ સારામાં સારી સારવાર મળે છે. તમે પ્રાઇવેટમાં હાલો જો એટલે કોઈની બાઇક હોય તો બાઇક જોવી પડે.
Yeah, basically the logistical challenges that patients face to access healthcare, and this is despite being a clinic or an organization that's based in a village. Is that, even the 20 or 30 rupees that a patient needs to come from their village to our village is sometimes, money that is too much for them to be able to spend. So I think that giving due regards to that, and therefore trying as much as possible to not overly inconvenience patients by asking them to follow too quickly, while still being able to balance and manage, the healthcare that we're delivering to them. I think that is something that I had never thought about, and just in general, I don't think that through my entire MBBS we were ever really taught the cost of medicines. We were just taught, okay, this medicine is the drug of choice for that condition, but how much does it cost? We never had any clue. So I think that that extremely high focus that we need to now pay attention to about how much does it actually cost for this patient to continue their treatment, and is it really going to be sustainable and possible for them to do that, to fulfill all of the demands that we're making of them. How can we make this more cost effective and more logical for them? After coming here, what I've also realized that I value is having a strong generalist perspective, where I still, like diabetes, hypertension, these are not things that I should have to refer a patient out to in order to treat. So going forward in my training as well, that's something I'm going to be looking for, more opportunities that offer integrated training and maybe certification and qualification in all of these things, to make sure that I can still continue to practice as a generalist as well as a specialist. But yeah, that is definitely something that perspective was kind of added only after I came here, and I saw the value that being a generalist with a specialist interest, what that has to offer. Something that really exceeded my expectations was the level of mentorship that I've gotten from Dr. Ashwin. I think that, I never expected in my limited interactions with both Nimita ma'am and Ashwin sir that, they would be as approachable and also, free with their knowledge and experience that they've acquired over the many years. And I've heard so many interesting stories about their journey before they started TRU and even after they started TRU, and that's all just been really inspiring and motivating to me as well. And yeah, overall I'd say I definitely have been liking my experience here so far. I think that it's been everything that I hoped that it would be, for sure.